to see all your faces and learn about you a little bit so we can see who's in this group. I haven't introduced myself. I am Nicole Dubuque, and I am the policy director for the Charter Division. I'm going to be leading today, and then me and Savannah are going to take over for me in a little bit. Leslie, can you start the slideshow? All right, so we just went through introductions, and then I want to talk a little bit about what the expectation is for future meetings. So today I really want to focus on housekeeping history and then show you what our plan is for the future state of STARS versus what it is now. We're not going to dive into the specific criteria today. We're just going to show like the basic concepts for what each level is now versus what it will be or what we're planning to propose for the revision. And then meeting number 2, which will be in June, and we'll talk about dates at the end today, is going to actually go through the criteria that's being proposed for levels 2, 3, and 4. Meeting number 3 is going to be going through level 5 criteria. I don't know how many of you in this group are familiar with the STARS evolution process. Like I said, Amy and Joanna are going to go through kind of the history in a minute. But it was proposed, so in 2019, there was a phase 1 change that again, we're going to go into detail about. And then phase 2 is proposed to go into a block system where level 5 had a menu of options. And so that's kind of where we're going and why level 5 will need its own meeting. And then meeting number 4, we're going to be talking specifically about the application support systems funding option. We'll get more into the coaching component that we are going to be introducing. I know Diane mentioned well-resourced, and that was something that has been brought up a lot, is having additional technical assistance and mentoring, coaching support, in addition to having assessors. So that's something we'll talk briefly about today, and we will get in further in a future meeting. And now I'm going to hand it over to Amy to start the history of STARS evolution. And I forgot about this slide last night too, didn't I? Sorry, so here is a slide because we asked you all in advance those 2 questions. What would you change and what would you keep? We also asked the other group who's meeting in the evenings. And so Leslie put together a little word cloud for us where we saw what came up most often. And we will be posting and sharing the PowerPoint after this presentation as well. But go ahead, Amy.
Okay, thank you, Nicole. So yeah, it's really nice. I'm looking at my screen and seeing lots of faces I know from the work to evolve STARS, as well as some new folks. And so I wanted to note that while we won't spend a lot of time on the history of work to redesign and revise STARS, we did want to ground us all in the history to give us kind of a shared starting point and context for discussions. So given that the focus of these meetings is to look forward and help the CDD create a revised QRIS that will work for you all, as opposed to looking back and talking about issues with the current system, we thought we'd talk about how we got to where we are today. Couple sort of overall points. You'll hear that the work has been ongoing for a long time. STARS was one of the first QRIS in our nation and has been one that other states have looked to. Some of you will recall finishing a first revision in 2010. Joanna, I think you started in the summer of 2010. And then as related to the current revision, phase 1 has been in place since 2019, and that really was in direct response to stakeholder feedback, like the feedback we're seeking in these groups. So Joanna, you're on, I'm passing the baton.
You're on mute, Joanna.
Thank you, Amy. I was just saying I'll try not to geek out quite as much on the history of the revisions and the STARS process as I did last night. So as Amy mentioned, STARS have been around for a long time. In 2002, Learning Partners, Inc. was contracted by the Child Development Division to develop and implement the STARS system. In November 2003, the STARS system was rolled out, and 3 home providers in the Northeast Kingdom were presented with the first STARS certificates. Over the next few years, the STARS system has been involved in soliciting stakeholder feedback. That's always been a really important part of our decision-making process of how things get changed and revised. So in 2007 and 2011, STARS participants were surveyed. In 2010, as Amy mentioned, the first revisions went into effect. There were changes in how professional development and qualifications and training points were calculated, and the application went from an every year application to only being renewed every 3 years in its full form. And also in 2010, Mary Johnson Children's Center became the administrator of STARS, and I came on board. During the next few years, there were lots of conversations that were had by the STARS Oversight Committee and the Child Development Division about beginning a process of revising the STARS system. We met with experts in data collection and analysis, Donna Bryant and Kelly Maxwell from Frank Porter Graham Institute. And we traveled to the Region 1 QRES conference, which is not the National Build Conference, but one just for the New England states and New York in 2012. In 2013, we formed an evaluation committee with community partners, Vermont After School. At the time, it was Vermont Birth to 3, Building Bright Futures, Agency of Education and Child Development Division, and the STARS staff. And began looking at the data that we currently had and trying to figure out how we could possibly use that to inform decisions about positive changes to make in the system. In 2014, that group prepared and presented a 10-year summative report and of the changes in the system and successes of the system for the first 10 years that it had been working. And then in May of 2014, that committee was disbanded. In December, once we knew there would be funding for an evaluation and validation study, there was an RFP that went out, and in May, Child Trends was the organization who was awarded the contract to evaluate and validate the STARS system. And there was a new subcommittee of the Oversight Committee that was formed. It was called the Evaluation, Validation, and Revision Work Group, later known as the Evolution Committee. In January of 2016, Child Trends completed an indicator analysis. So what that means is that they analyzed the criteria for STARS to determine whether those indicators were actually indicators of quality or not, and presented that to the Child Development Division and the Oversight Committee, along with an analysis of our system that we currently have, which is a hybrid of blocks and points, and gave us some information about what the plus and minuses are of a block system, a point system, or a hybrid of the two. In June of 2016, the validation study began, And some of you may have participated in that. Assessors for who are working for Child Trends came and did program assessments to determine if program quality, if the star levels were really indicators of actual program quality. In 2017, Child Trends conducted a virtual pilot. So what they did was they took the current STARS criteria, put them in a block, made an imaginary block system using those criteria, and then as a child care program ran through a STARS application to determine if programs would maintain their star level if in a block system using the same criteria that we had now. And they're determined that many programs would decrease possibly by as much as 2 stars if that were to be how the new system was revised. So the back to the evaluation, validation, revision work group, that work group resumed at that point and began looking at how to redefine the criteria for stars so that programs could be successful in maintaining their star level in transitioning to a new system. So in 2018, an outside facilitator was contracted to help with the revision criteria, and we began working on specific criteria for the phase 2 of the STARS revisions. That will be what we're going to be talking about in these meetings. And in November of 2018, planning began for the rollout of phase 1. And then in September of 2019, phase 1 was rolled out. The regulatory history arena was done away with. All programs who are regulated and in good standing now are eligible for 1 star. And there is no specific, requirement for specialized care agreement for families and community points. And I apologize for my phone ringing. And Amy, I'll hand off to you now.
Thank you. Thanks, Joanna. Yeah, so as Joanna mentioned, let's see, in 2019, we had phase 1 of the redesign. And I just wanted to note that we've been talking a little bit about stakeholder engagement, and some of you will remember that folks from the Child Development Division went on tour across Vermont in the spring of 2019, I think into sort of the middle of June, to present those proposed revisions for phase 2 with the goal of getting reactions and feedback. We did at that time receive hundreds of comments, and we spent that summer with the Evolution Committee and Child Development Division using that feedback to make changes to our draft. Let's see, also toward the end of 2019, the CDD convened several work groups to develop supporting information for the next phase of STARS evolution. And many of you were involved in those. And then in December, the very end of 2019, the STARS Evolution Committee wrapped up its work. Those work groups that I mentioned continued their work into the beginning of 2020. And then we all know what happened in March of 2020, that was the beginning of COVID emergency shutdown. And at that time, the work groups were disbanded. Let's see, in 2020, the STARS Oversight Committee worked on and finished a draft of what at that time was a 5-star level points menu that was to be presented to the Child Development Division for consideration. This was never, in fact, this document was never, in fact, vetted by the CDD. But I wanted to note that the STARS revision group, our internal group, will be taking a look at what's on it as a foundational piece that will help us build STARS level 5 criteria that we'll be presenting to you at one of this group's future meetings. Let's see. There wasn't a lot of substantive work on STARS. It kind of continued on hold in 2021 with one exception, and that was that Joanna mentioned the BUILD initiative. This is an organization that is about all things QRIS and brings folks together from across the country to talk about improvement systems every year. That year, the meeting was virtual, and some research that was presented was really interesting to many of us. And so the Child Development Division took a hard look at it. And in the wake of that, we decided to bring together some folks to be part of a think tank in December. Let's see. So that kind of really brings us to this year, to 2021. There was research in 2020 and 2021. I don't know if I said that correctly. There was additional research in 2021, similarly at the BUILD conference, which we're bringing forward to consider in this process that you're part of. So I wanted to note also, many of you know that the STARS office, which has been administering the STARS grant, has been with us, as you know, for many years and will conclude on June 30th. And that will bring us into a transition year for the system where work will be done internally here at the CDD. And I think the only other thing that I wanted you to know, I referred to an internal team, a QRIS planning team. We've been meeting since December-ish with our federal technical assistance partners, federal TA, and we'll be continuing to meet and work on materials to bring to you in these groups and then throughout this transition year. I think that's it. Does anyone have any questions? So Joanne, I'm tempted to tease you and say you geeked out almost as much as last night, but but it's great information. Thank you. Nicole, you're on.
Yeah, thank you. So I think we're going to move into just a quick overview, and Joanna, you know this too, so feel free to jump on in where you want to, but I just want to give a quick overview. You all are involved with STARS. You all have done applications for STARS, so this probably will feel very familiar to you. This is just to show you kind of how STAR level is determined right now. So we have our 4 arenas, which is staff qualifications and training, program practices, families and communities and administration, and you have points awarded in each arena, and those points are totaled, and then you end up with a score between 1 and 4 points, 5 and 8 points, 9 and 11, 12 to 14, and whatever tier that lands on is the STAR level, right? So tier 1 is regulatory compliance, that's STAR level 1. That's where we kind of ended the evolution process, really, right, with the last phase 1 that went through in January of 2019, where everyone participates as long as they're in regulatory compliance, STAR level 1, and then the points go up from there. So this is our current system. Does anybody have questions on this? I figure this is pretty familiar to most of you. All right, I know you're all waiting for the next slide, right? Where are we going? So we are going to be proposing, and this is what we're going to look for feedback from you all in these groups, that we move from a high stakes point system to more of a block system. And I know Joanna had mentioned in her overview of history, and I think Amy touched on it a little bit too, that we had looked at moving to a block system before. This would be a little bit more of a hybrid where it would be blocks for STAR level 1, 2, 3, and 4, and we would do a menu of options for STAR level 5. So STAR level 1 programs have a solid foundation focused on safe and healthy environment for children to learn and grow, measured by compliance and good standing with licensing. Absolutely no change here. Star level 2, programs implement additional program practices known to have positive impacts on child outcomes. Programs begin to build a CQI plan. So this is one of the things that we would really like to build into the next version of STARS. I think Luann talked about this in her introduction too, is that we'd really like to have a focus on continuous quality improvement. So we want programs to be able to develop a plan and review and revise that plan as they go through the STAR levels. And I think this is a good time to bring up that we are looking at how we are going to bring in STARS coaches into the system. That is something we don't have right now. We have the STARS office and we have STARS assessors, which provide technical assistance, but we don't truly have like a coaching or mentoring function that programs can look to when they need help finding resources, when they need help working on a CQI plan, when they want to look for advice on how to implement something in their program. So we're going to be introducing coaches as well as having assessors in the new proposal of the program. It will not be mandatory for programs to work with a coach. It will just be that they are available to help with the continuous quality improvement process. So that's something we'll talk about more at a later meeting, but since we're starting to talk about CQI here, I wanted to bring that up. 3 stars, programs intentionally promote children's learning and development through observation and child assessment. 4 stars, programs support a quality learning environment and curriculum implementation and social and emotional interactions. And then 5 stars, programs CQI plan includes data from an improved menu of assessment tools. So this is really one sentence about each star level. I know it doesn't tell you much, but this is the themes from each block as we're proposing. Now we're going to go into each one individually, and then at our meeting in June, we will talk about the individual criteria that will be in each block. But I'm happy to pause if people have questions here. Or would you like to go forward and ask questions through each block? All right, go forth, Leslie. Thank you. Okay, so 1 star. This is just a good visual, like I said, that we're going to post where it shows how we describe our 1 star level now versus how it will be described in the future. And we will, again, post this. So 1 star programs are programs that have a full license based on the appropriate child care licensing regulations. Again, this is not changing. This will be the 1 star level, good regulatory standing with state licensing regulations. 2 stars, please. The 2 star programs currently 1 to 4 points are making a commitment to strengthen their practices. They may have made some progress in many arenas or more progress in 1 or 2 arenas. So in the new version of level 2, it will be meeting all the criteria in level 1, which is just good regulatory compliance, and establishing policies and program practices with a focus on quality measures for child outcomes, and begins to implement a continuous quality improvement plan. So there was a really good question that came up last night that I'm going to try to repeat about the current system and being able to be a new program or, you know, a second site of an existing program and being able to come in and do your application and start at like star level 3 or star level 4, or if you have an accreditation 4 or 5. That's still going to be the case. It's not that you have to start at star level 2, start your continuous quality improvement plan and move your way up. It's going to be very similar. But I just want to put that out there because I know that that was a concern and a question in the last group. Any questions here for 2 stars?
Yes, I have a question.
Mm-hmm.
So when we look at the existing criteria, they may have made some progress in many arenas or more progress in 1 or 2 arenas. How are we determining the point at which, how do they know, where's the starting point where they've identified the need to make progress?
Are you talking about the current system or the future system? Because I hear you talking about the making progress in the arenas.
Yeah, I'm talking about the current system, but it's going to connect to the block level. So let's see if I can rephrase this question to capture. So, so we're looking for a commitment to continuous improvement. That's what I'm gathering from this level. But there has to be a starting point at which you decide this is my starting point and this is where I need to show progress. So where we say in the new block level begins to implement a continuous quality improvement plan, we have to have a starting point in order to develop that. And so,
and that's in the
evidence.
Yeah, so Deb, that's actually in the detailed criteria that we're going to go through next meeting. So we do outline which policies and program practices we want there to be established for block level 2.
Okay, thank you.
Yeah, so we do establish what policies and program practices need to be established, and you will have this criteria, and you will have outline for STAR level 3, 4, and 5, right? So you can be able to develop your continuous quality improvement plan if you are deemed a 2-star program to increase the policies and the program practices so that you can elevate to the higher levels. So the continuous quality improvement plan will be based on what the criteria are in the higher levels, and then also the program's individual goals.
Okay, thanks.
Yes. And Leslie just mentioned to me on the side, which I haven't mentioned in this group yet, but we are planning to have a guidance manual. So it's going to look very similar to what we have for that goes along with our licensing regulations. We are going to have a guidance manual for this that will hopefully be another piece that is helpful should programs want to try to work through that independently or with a coach, or have, we want options. So we will have that established as well. Any other questions on 2 stars? Okay. 3 stars. So currently, it's 5 to 8 points for a 3-star level. And what the STARS office is looking for is that the program has made improvements and are working to reach specific goals. They have either made substantial progress in 2 or 3 arenas or have made some improvements across all 4 arenas. That's kind of the general summary. Obviously, we know that the application is fairly long and that there's like specific pieces and verifications that need to be sent, but this is the general idea. And in the proposal for the new 3-star level, we would ask that all criteria for levels 1 and 2 are met. And that also the program continues developing policies and program practices. This also will be outlined. We will have criteria about what those policies and program practices should be, and begins to incorporate self-assessment data from approved tools. And then also reviews and revises continuous quality improvement plan. And I do just want to put it out there because nobody's asked the question yet about how this might impact your STAR level. And I will just say that we know and we hope to get more information and feedback from this group. But our understanding is that most of the things that we are looking to require at each level are essentially policies and practices that a lot of programs are doing that are already at those levels. So while the way that you get to a STAR level will be assessed a bit differently, it's unlikely that there will be a 4-star program that all of a sudden sees what our criteria is and is not doing that already. Like that would probably be not the average scenario. So I just want to put that out there. Any questions on 3 stars? Go ahead. I think is that Melissa? Sorry, everyone got really small.
Yeah, so it says begins to incorporate self-assessment data from approved tools. Now, I'm 3 stars, and listen, I had the renewal, and I can tell you, I re I went through my emails and got the information to submit the halfway point, you know. Um, but I never put in there that I got my bachelor's degree because I didn't have time to deal with that. So what exactly is the approved tools?
Yeah, so
Because the
there are.
process right now is kind of difficult to meet the 3 stars and to maintain it. So when the renewal process or the halfway point, as they called it, came up, and I had to submit the information, I keep everything in a folder in my email that's and labeled what it is or what it could be used for. Um, and that's how I was able to do it. But, as a home child care provider, I don't have much time to spend 8 to 12 hours getting all this paperwork together.
So I think there's a few things that will alleviate that. One is, I know Maggie's on this call. She is our new communications and outreach coordinator, who this is day 4 on the job for her. But she is going to work on the current STARS application as it exists now and being able to make that electronic. And we're also looking at what tools we have for there to be an uploader so that a lot of those documents can be put online. And that's before we even go into the new program. That's something that we're working on right now to alleviate some of that paperwork burden. As far as answering your question about self-assessment data from approved tools, there are a lot of tools out there, and we are working with federal TA on what exactly we're going to be using in Vermont or what we would like to use in Vermont. And that's going to be something that we're going to talk about at a future meeting with you all. And we're going to give you some information in advance about that so that you can take a look at what the tools are going to be and what it would require of you. But really, it's using these tools to assess the practices in your own program. Is that helpful?
Somewhat. If it gets, my only concern is if it gets too complex as you continue to go to 4 stars and 5 stars, the home child care providers for the home, they're not even going to want to even move up with the stars because, I'm one person and I have 10 children. I mean, it's a quiet afternoon. No one's here today until after school. So you don't have much time when you're prepping and doing all this stuff to keep track of that when you have a family of your own. So just
Yeah, I think.
trying to make sure that it's not going to add more stress.
Yeah, I think that one of our big goals here is to make sure that the new iteration of the program is less administratively burdensome. So I think that's valid feedback to give, and that we will look at that when we are finalizing what tools we want to put forward. And then also, I think it'll be very helpful to have coaches that could help with some of that as well. Any other questions on 3 stars, and then we can move to 4. Okay, let's go to 4 stars. All right, so currently 4-star programs are at 9 to 11 points, and they are established programs that have met several standards of quality in all 4 arenas. Many 4-star programs are also nationally accredited. So we have not done this crosswalk yet with national accreditations or with some other things that we have crosswalked in our current program. And what I mean by that is that there are like if we're talking about Head Start, NACE accreditation, et cetera, right? In the current program, there are a lot of those accreditations that have perhaps higher standards than STARS does already. And so there have been crosswalks done to determine where that is true. And so applicants' programs can automatically come in with those accreditations at a higher STAR level. I don't know all the details about how that verification is collected right now, but I'm sure it will be very similar. I don't know, Joanna or Amy, if you want to add any detail. Did I cover it?
Nicole, do you mean how the crosswalk is done?
I just mean we haven't done it yet for the current program, but that was a
Right.
question we got last night about if you're an AC accredited program, will you still be able to come in at a higher STAR level? And I think the answer is yes, but we have not done that crosswalk yet.
I think the way that I would say it is we have an intention to crosswalk once the criteria are finalized. And we would crosswalk those criteria with the criteria or indicators, whatever the language is, in the systems of, for example, NAEYC or Head Start. And the reason that we are presuming with some certainty that it's unlikely that it will change for programs is that we're basing the work that we're doing now on the work that was done before. And we are not making the kinds of changes that we think would get in the way of that, I guess. And so we're making, I think, a pretty solid assumption that, as you said earlier, Nicole, it's unlikely that a program's STAR status will change. We can't say that for sure until these criteria are done, but we really are intent upon building on what all the work that we did before, and we did do those crosswalks previously. Does that help?
Yeah, I hope so. I'm just trying to make sure that we're being clear. Okay, so in the new version of 4 stars, we'll be looking for programs to meet all criteria for levels 1, 2, and 3. And the program is going to be elevating policies and program practices, incorporating valid and reliable data from approved assessments, and implementing a responsive curriculum, and again, reviews and revises continuous quality improvement plan. I feel like if you look at kind of what the indicators and where you're getting points in arenas now, that this is a fairly similar level to where it is now for 4 stars. Any questions on this level? Okay. 5 stars. So right now, 12 to 14 points, outstanding in all 4 arenas. Again, many 5-star programs are also nationally accredited. In the new version, this is where the menu comes into play. So the program would need to meet criteria for levels 1, 2, 3, and 4, elevates policies and implements program practices based on a menu of quality indicators and assessments, and reviews and revises the continuous quality improvement plan, incorporating data from a list of state-approved assessments that will be in the guidance manual and will be provided as we go through the criteria in depth at future meetings. So at this point, I'm going to open it up for all questions, and then I'm going to hand it to Leslie. Or do you want me to do the meetings, Leslie, or do you have sound availability at your house right now? And then we'll go to scheduling the meetings for June, July, and September. Okay. All right, so right now we have dates, and I'm going to put them in the chat. Let me know if there's anything that I'm missing in your worlds where these dates are not going to work for many of you. Also, if you are not able to make one of the dates and you have someone from your program that would like to attend for you, we just ask that you let us know that in advance and that you just brief them on what we talked about today so that they can be level set as well. The first
And I
date is going to, go ahead.
I think we also just want to mention the webpage too will be going up probably tomorrow at this point. So we will have the slides and the recording. Excuse me, I'm sorry. And you know, other documents from the slides. We'll also have the questions that we asked as pre-work and another survey that you can access to put in any comments that you have about this presentation, so that you can give feedback as you have time to think about what was presented today. So we'll have that up tomorrow so you can access that, and we'll email that link out to everybody for sure.
Awesome. So I just put it in the chat. I don't know if everyone can access the chat, but the next meeting will be June 16th. We did 1 to 3 p.m. We're hoping that that works. I think that going through the criteria, we might need a little bit more time. Then July 21st, 1 to 2:30 p.m. and September 15th, 1 to 2:30 p.m. We're skipping August because I know that's like a lot of vacations and in-service days for folks. So this will be the schedule. And then I see that there's a hand up. I can't see who, Diane?
It's me, it's Diane. Leslie, when you mentioned the information going up on the website, is that available to just the people working on this revision, or is that available to anybody, and anybody is welcome to comment and ask questions?
Yes.
Yeah. Okay, thank you.
Any other questions, comments? Tanya?
So if it's being recorded, are they being recorded every meeting?
Mhm.
So I'm on vacation on June 16th. So could I watch the recording afterwards to catch up? Is that an option?
Yep, and you can also send feedback prior to. We're going to have the
Okay.
survey tool up, so yeah.
Perfect.